Welcome to Image in Alaska podcast. My name is Ward Hinger. I'm the Chief Administrative Officer for Alaska Radiology Associates. I'm also the CEO for Imaging Associates. Alaska Radiology Associates has a management support contract for Imaging Associates, world-class diagnostic services in Anchorage, Eagle River, and the Mat-Su Valley. Today, our guest is Jen Irish from the beautiful state of Texas. Jen represents Myriad, a best-in-class organization specializing in genetic testing and counseling. Imaging Associates' partnership with Myriad is a paramount as we offer our guests, our patients, seeking breast screening exams and diagnostic exams, the option for genetic testing and counseling. We offer this option as a highlight to our breast imaging centers of excellence, which can be attained at any of our three sites, again, in Anchorage, Eagle River, and the Mat-Su Valley. Good morning, Jen.
Good morning, Ward. Thanks for having me.
Welcome back to Alaska.
Thank you.
Yeah, this is kind of a unique time of the year. Spring skiing is still going on. The leaves aren't back. I know you're from Lubbock, Texas, where spring is well under its way.
Correct.
Yeah.
Correct.
But how was your flight in?
It was fantastic. Much more beautiful weather than the last time I was here with you.
Yeah, it was dark, snowy. Record amount of snow, I think.
It
We're damn near
was.
close to
January.
it. Yeah. Well, really love having you back here, and we appreciate you joining us on this podcast to provide our patients, and we call our patients our guests, as they are, an overview of our partnership and what our guests can expect if they identify as a candidate for genetic testing and, number two, decide to proceed forward. So first, can you share with me some background on Myriad and why your organization is considered to be on the cutting edge of genetic testing and counseling?
Absolutely. I personally have been involved with Myriad Genetics for over 10 years, so I've been there a while. But if you go back to the beginning of the story when Myriad first came to be, it was in 1996. That was the year BRCA was commercially launched. And that goes back to where the BRCA1 and 2 genes that everyone hears about. Angelina Jolie was kind of the poster child of it at that time. She was one of the original first celebrities that came out about her genetic testing journey. But that's where Myriad started. And then from then, year after year, we've advanced technology, advanced the science, the research. The more we learn every day about cancer and how it impacts patients and creating that plan to catch it early.
Yeah.
Or to prevent it altogether in some cases,
Right.
It's fantastic. And here we are in current state. We just launched our last enhancement was Risk Score, which gives a personal breast cancer risk to every single woman that qualifies for testing and moves forward with genetics.
That's awesome. Now, we both thought that the month of April would be a good time to get the word out to Alaskans, as April is Cancer Prevention Month and International DNA Day.
Yes.
Oh,
yes.
And
there's a whole day dedicated to
there's
it.
a whole day. So let's walk through what Imaging Associates guests, the patients, can expect regarding the option for genetic testing when they come in for a screening or a diagnostic mammography. So first, obviously, if I'm a patient of Imaging Associates, I'm going to schedule a screening or a diagnostic mammography, right?
Correct.
And
correct.
that scheduling process is made really easy with our patient portal. They'll get a little link in the email, and they can schedule themselves. They present at our spa-like atmosphere. They check in, register. It's contactless check-in is what we call it. And they basically just walk straight through the waiting room to our technologist. So from there, can you explain to our patients in Alaska what they could expect at that point on?
Absolutely. At that point, you have your screening or a diagnostic mammogram. And at the end of that, you have the option, again, to meet with a breast care coordinator who will walk the patient through the genetics journey, essentially. And what that encompasses is allowing a patient to watch a brief video. It's about 3 minutes long on hereditary cancer, because hereditary cancer, again, we're not talking every cancer that's out there is hereditary, but we're speaking towards the specific ones that can be passed down from generation to generation via DNA. So once they watch the video, they're able to connect live with a board-certified genetic counselor within your center.
Can I just back up a little bit?
Sure.
I'm a real simplistic individual, so I come in, I get the screening exam, and part of the screening exam is a very simplistic questionnaire
Correct.
And
correct.
the questionnaire literally is 7 questions, right?
It is.
And if I answer yes to any one of these 7 questions, then I'm eligible for genetic counseling. Is that true? Am I stating that correct?
That is true.
Okay.
The guidelines have changed and they continue to change, but these are very high level questions that
Sure.
if you answer yes to a single one of them, for example, a single breast cancer in a family member under the age of 50, that qualifies you for genetics.
Great.
Yeah.
Great. And so from this point on, my exam is done. I've answered yes to one of the questions hypothetically. And then at that point in time, I'm asked the question, do you want to proceed?
Correct.
In connecting with one of Imaging Associates' breast care coordinators. Just for the public to understand, Imaging Associates Breast Imaging Centers of Excellence have breast care coordinators. These are registered nurses, advanced nurse practitioners that have specific training in breast oncology in the continuum of care. And we offer that at no cost to the patient at all. So after the patient is finished with their screening and or diagnostic mammography, if they said yes, I answered yes, and yes, I would like to take the next step and visit with a breast care coordinator. A breast care coordinator meets with them at the exam room and ushers them into a private area into the breast care coordination room, and it's private, and they sit down. And then at that point in time, did you say that there's a short video demonstration for them to review?
There is.
Okay.
It's a little over 3 minutes long, just gives an overview of hereditary cancer. And at that point, they connect live with one of our board-certified genetic counselors.
Oh, how long does that take? 15, 20, 30 minutes?
As long as the patient needs, because...
I mean, as far as because you're contacting somebody live.
Right.
That's trained as a genetic counselor. It's a master's degree training.
Absolutely.
And so how long does that take? I mean, I'm sitting down, I'm watching the video. How long does the video take?
3 minutes, and then a genetic counselor will be on the other end of the line in about a minute and a half. It's
okay.
Point of care.
So my breast care coordinators are actually going to get the genetic counselor on the phone while they're finishing up with the video. So it's pretty
Correct.
seamless. Boom, boom. All right. So we're talking about 4 minutes later, 3.5 minutes later, they have a GC, a genetic counselor, on the phone. What is the genetic counselor going to review with the patient at that time?
Great question. They're going to go over all of the different cancers that happen in that family. And
Wow.
there's some preconceived notions that it takes a lot of cancers to qualify for genetics or for a need for genetics. But
Right.
the example I gave you earlier, it only takes one.
Okay.
It doesn't have to be this massive family history. So they'll collect all that history. They'll go over, the implications of testing, what that means to them, what that means to their families, how it's handled with insurance, privacy.
What are the implications?
I mean, there's different medical management things that will happen based on that genetic test result.
Sure.
So let's say there is found to be we call it a broken gene, just for an easy way to think of it.
Sure.
Your DNA, doesn't change truly over the course of your life. You're born with it. And some people have broken genes that predispose them to cancer.
Oh,
Their
wow.
body's not able to replicate and correct those cells like
Wow.
the average person can.
Yeah.
And when you know that, you know what cancers that patient may be predisposed to, and you can create an action plan based on that.
So backing up this broken gene. So as a patient, I guess a sample is taken while I'm at Imaging Associates.
Yes, and it is saliva, so
It's
it's
saliva.
not even a blood stick.
Okay, so there's no pokes.
Nope,
That's great.
no
It's a
pokes.
simple. So basically, I probably want to abstain from drinking water, chewing gum, anything that could inhibit a good clean sample.
Absolutely.
Okay, and so I get the sample. I say yes, I want to proceed forward. I get the sample there in the office at that time. That sample's sent off.
Yes.
Okay, how long before the results come back?
It's about 2 weeks, and there's one step in between too. Just in the case of just transparency, that patient, once we receive the sample, and it all goes to Salt Lake City, Utah, so all of our samples go there. The patient will receive an actual estimate, a cost estimate that shows, with your insurance, this should be covered at 100%. Which we see most of them are covered fully because
that's great.
Because it's viewed as prevention, like screening mammography.
That's good news. we were just talking before we started this podcast, the inflationary bite that everyone's feeling.
Absolutely.
And with regards to prevention, we don't want anything getting in the way between the patient and doing the right thing. And so there's mechanisms. We're highly confident that insurance will cover this 100% if they identify as positive, if they answer yes to one of the questions. And if not, there's mechanisms for us to help the patient with the cost, which is what, a couple $100?
I mean, there is a direct pay option. If you didn't have insurance or you didn't meet guidelines that you could pay, yes,
Right.
and it's under $250.
It's under $250. Okay.
We don't see many patients even have the need for that, though, because most of it is covered, or we have financial assistance options within Myriad to help out patients, maybe that are underinsured or uninsured.
Okay. So just backing up in the continuum of experience here, again, I'm a patient. I've had the sample done. I've talked to the genetic counselor. I understand all the ramifications of what's going to happen, next, whether it's positive or negative. If it's negative, then what?
Then you follow your general population screenings.
Okay.
So that's the key thing. And the reason for genetic testing is so that each individual patient or guest, as you put it, that comes into your center has that personalized plan.
Exactly.
Do you need additional screening modalities? Do you need breast MRs? Do you need, in some cases, even it could have an implication that's ovarian cancer or something like that. Things that are silent killers. I mean, we talk about them. They're found too late, but
Right.
patients can do something to prevent that or catch that extremely early. So it's important.
So the test results come back, and God forbid if it's positive, that there's something broken in the DNA, right? Is that what you're saying?
Yes.
Sorry, I'm not a genetic counselor.
Neither am I,
don't have
but
a master's degree. You're a lot smarter than I am. So it comes back positive. The results come back to the breast care coordinator, the nurse, mid-level.
Correct.
Is that correct?
Correct.
And then they reach out to the patient.
Yes, and they will walk the patient through that result.
Okay.
But also on the back end, that same team of genetic counselors are available to the patient and to their families to walk through at no additional cost or anything to the patient.
All right. So what Imaging Associates wants to do is obviously leverage our nurse practitioners to reach out, have that conversation in person is what we would prefer.
Yes.
And again, we don't charge for those visits at all. Our nurse practitioners have agreements. Many of them have agreements with the referring physicians to where they can order additional testing. And the key here is that they keep in touch with that patient's primary care manager. So there's nothing missed at all on that. And you're saying if it is positive for breast, then that could open the door for additional testing.
Absolutely.
Yeah.
And being covered by their insurance, it can make the difference. You calculate, breast stress using Tyrer-Cuzick.
Sure.
Those patients that have greater than 20% lifetime risk qualify for more things.
Yeah.
There's even more things on the table. Again, if you come back positive for one of these genetic mutations, yes, it's not the norm, right? It's the smaller percentage, but that's the only way you truly know that patient's risk.
Wow. This is fascinating. And of course, with Imaging Associates being a breast imaging center of excellence, we do all services in one place, from breast MRIs, breast MRI, biopsies, ultrasound, contrast enhanced digital mammography. It's kind of a one-stop shop. It is a one-stop shop. This is so exciting, and I know there's some administrative things that we're going to do with our electronic medical record system to make this very seamless and automated. So we're looking at launching this in about maybe 5 or 6 days. We're going to be ready to go live on this. So we're just around the corner, and the timing couldn't be more perfect. Again, given it's Cancer Awareness Month, et cetera, this is just great. And I'm looking at a flow chart here. I'm not going to hold it up. It'd be an eye chart for our customers, our guests. But a lot of thought went through viewing every step through the lens of our customers, of our patients. And I want to thank you for helping us do that with your level of experience. It's been a real pleasure working with you. I remember you sharing with me, and if you don't want to go there, that's fine. I remember sharing with me in the past that you have a personal experience with this. Would you mind sharing with wonderful Alaskans what that experience was?
Absolutely. Happy to. I can approach this from the lens of, yes, I do work for Myriad Genetics, and I have for 10 years, but also from the lens of a patient and the patient experience. Again, I am adopted, so I didn't know my family history.
Wow. I'm
one of those people that every time you go into a doctor's office and they're like, "What's your family history?" I'm like, "I don't know."
Yeah.
No clue. So actually it was 2017, my family, my children, for Mother's Day, bought me an Ancestry.com test.
Oh my God.
Again, very, very different genetic kind of test than what we're talking about, you and I today.
Yep.
That's a diagnostic. But just let's see where, are you as Irish as you think you are or whatnot, right? My last name being Irish. And funny to point out, I'm actually more Irish than my husband.
Wow.
Whose last name is Irish. So the word Irish. But anyway,
that is funny.
Fast forwarding. Through that, I actually found out some of my family history because I found out my birth mother through that test. So, yeah.
Did you contact your birth mother?
Actually, it was a first cousin reached out to me and asked if I wanted to be added to their family tree because he curated everything. I'm like, well, that would be great if I knew who my mother and father were. I don't know. And just fast forward, put all the pieces together, and he was my first cousin, and found out I have half sisters and found out my birth mother. But through that entire experience, one of the first things I wanted to know, again, because I know how important it is to know that family history, like, is there any cancer in the family?
Oh my.
Can you just tell me that? And there was. My maternal grandfather had passed away from pancreatic cancer in his 60s. There was a case of colon, out there. My maternal grandmother had passed away. They just said a female cancer because no one really knew. She just died. And we see that, right? Yeah. We see that in histories. So for me, I knew pancreatic cancer, if there's one case of it in your family history, you qualify for genetic testing. And I knew that since I worked for the company. So I immediately walked into my doctor's office and said, I need genetic testing. Here's my order. Like, I want this today. So while my test was in the lab at Myriad, my maternal uncle was diagnosed with pancreatic cancer.
Oh, wow.
And he passed away before my test even reported out. So it was, it's very
fast cancer.
Yes. Yeah. Well, and it was found so late.
Right.
Right.
Yeah.
It was found way too late.
Right.
And that's the whole idea behind this is
early
when you
detection.
know, you look for it.
Yeah.
And so again, fast forward, I get my test results, and I am one of those people that has that break in my DNA. And so I am positive for what's called a PMS2 mutation, which predisposes me to, you can probably guess one of the cancers, pancreatic's in there. Ovarian's in there, endometrial, colon. I mean, there's different implications, but the thing is with this, I also knew my breast risk, and my breast risk is actually lower than general population.
Oh, wow.
Because I have some protective things when it comes to breast so I knew that, right? That was not what I needed to be. Yes, I get my screening mammograms every year without doubt, but I needed other interventions.
Well, it's amazing you talked about being adopted. I don't know what the percentage is in Alaska, but I think there's probably a high percentage of children in Alaska that are adopted too, and they don't know that family history.
Right.
So what a story.
Well, and it is amazing. I went to did surgical indications. I'm almost 50. I've done having children. Obviously, my children are adults now. So I opted to have my ovaries removed and, a total hysterectomy, decrease that risk almost completely. But I also get MRIs, abdominal MRIs every year, because if we can just lay their eyes on my pancreas, see if anything's changing, again, we can catch it early.
Because you have that baseline established.
Exactly. Yeah. And it's covered by my insurance because of my genetic status. So.
Yeah. What a thank you so much for being vulnerable and sharing your experience there. It must have been emotional for you and quite a roller coaster. But at the end of the day, I think it was a blessing that this all took
100%.
place.
I look at it as, and that's something that we hear. It's like, I don't want to know.
Yeah.
But I would challenge that because, you do want to know because knowledge is power. If
True.
you don't know, you
Yeah.
can't do anything to prevent or to catch early. And it's something that, again, passes down generation to generation. I brought this information to my entire, birth family. They had no idea.
Right.
People just died of cancer.
Yeah.
Now they're empowered with information so that we can break that trend.
I'm just fascinated because I'm so excited not only what we can do at Imogen Associates, but with all the partnerships that we have in the state through Alaska Radiology Associates. Whether it's Kotzebue, Nome, Barrow, Samuel Simmons Hospital in Barrow, Norton Sound Healthcare Corporation, Manilik, Anchorage Neighborhood Health Clinic, and even our relationship with Providence. It's time to get the good news out there and let people know that, and we say this all the time, early detection saves lives, really does. I have nothing else to really cover, but I wanted to just close it with you, Jen. Is there anything else that you would like to discuss, talk about with regards to this wonderful offering that we're taking to the communities that we serve in Alaska?
I mean, I just first want to thank you for entrusting Myriad with this partnership because, again, we roll out these programs nationally. And every program that we roll out, just the patient lives impacted in that story is so powerful. And that's what gets me out of bed in the mornings is knowing all the patient lives that we are saving.
Right.
And so I thank you for bringing this service to the people of Alaska. And it brings everyone up.
Yes. I'm just kind of speechless right now. This partnership is going to be amazing. This won't be our first podcast. I think down the road here, we're going to have some exciting stories that are Alaska-centric stories that we can share with the people that we serve in this last frontier. Jen, thank you so much for joining us. Thank you so much for partnering with Imaging Associates and Alaska Radiology Associates in getting the good word out there. Thank you.
Absolutely. Thank you.
Imaging Alaska, expert radiology, exceptional care.